At first glance, Westminster may well look like one of the wealthiest places in the country, but deep down we have really significant issues with inequalities, and many of them have big impacts on people's health. A baby born in the north of the borough today, if they're a boy, has 18 years less life expectancy than a baby born in the south of the borough.
So Church Street area in general has a higher prevalence or a higher number of patients that suffer with respiratory problems. Most of our residents live very near to the Marylebone Road, which has been seen to be one of the most polluted roads in Britain. Housing is also somewhat of an issue locally, particularly with regard to damp and mould and the effect that that has on existing respiratory conditions too. So I think some of these issues are related to wider determinants of health, so things that we can't do from within our four walls of a healthcare setting. There are things much bigger and wider than that that can have major impact. So I really can't do very much about local air quality. I really can't do very much about housing in which our residents stay. And there are a number of other things too that collectively we can come together for better outcomes for our patients if we think as a larger group.
On diagnosis of a lung condition, I started up hosting an organisation under the umbrella of Asthma and Lung UK called Breathe Easy. So we're able to give the extra support and advice. We talk a lot about pollution, that's really become up there, which is great. But indoor pollution isn't spoken much about, and housing, the conditions in substandard housing, which is now taking focus, but whether landlords and housing associations and the council can actually sort that is a big issue which really affects people.
So obviously any repair, whether that be damp or even something minor, can have quite a negative effect on a resident's mental health. It's your home, so anything that's wrong with your home that makes you uncomfortable is a serious issue. But obviously damp is more so an issue that can affect your health. So it's something we want to try and resolve as thoroughly as possible. So we're heavily investing in specialist ventilation systems to help improve air quality within properties. And more specifically now we're currently running a pilot project across Mozart Estate, Lisson Grove and Queen's Park Court, and it's trialling 100 properties for air quality and humidity sensors within homes.
Green Doctors provide free energy saving advice in the home. So for people with asthma and other respiratory conditions, the really beneficial advice and support that Green Doctors provide is all around eliminating drafts in people's homes, so stopping that cold air from getting in that can really exacerbate some respiratory conditions, giving out advice around how to prevent damp and mould in the home, which can also have negative effects on people with asthma. And also what we do is we help give out and install what we call sort of free energy saving measures. So that's for draft proofing. That can be stuff like the strips for your door and your letterbox that help stop those cold air from getting in.
So one of the things that we're really interested in is learning from others' great work and how they have gone about tackling some of these big gaps in life expectancy. So one of the places that I found really interesting and had some great connections with was Rush University Medical Centre in Chicago. They realised that surrounding their local communities and their hospitals that there was this massive life expectancy gap and huge inequalities in how long people lived and their health outcomes. So they went out and they listened to their communities to understand why some of these things existed, and they found things like structural racism and economic deprivation were big factors within that. And they thought, well, as a hospital, what can we do? We patch up sick people. But they looked across the lots of the work that they were doing and realised that who they employ, where they make their investments in their services and goods, how they use their buildings and land, and how they work in partnership with organisations in their local communities can really affect those issues that help to change people's life expectancy and their health equity. So they developed a whole system approach to health equity under their anchor institution approach, and it's called Westside United, and it's an amazing set of programs and work that sits across both the hospital but also lots of local partners, and it's really centred on understanding the community and what they need and helping them to really be at the forefront of how do you make changes to equity and to people's health and outcomes.
Went out to the community, you'll hear a bit more about this in a minute. And of course, what the community said is exactly what Lena and others said is, how about you come out and you talk about the things that are important to us? How about you talk about our housing? How about you talk about employment and education? Come and listen to us and understand these things, and possibly an output from that will be some of the things that you're really worried about, some of your indicators. If we are going to do the things we have done all these years, and I'm talking about decades, where we think we know the right thing, we're going to get the same results. The only way to do it is to start listening to our communities in a very different way. But actually, this isn't a project. This is the very foundation of how we change inequalities within our borough and outside, because of course it will affect it, as we know. It's not a project that's got a start date and a finish date. Also not a council or an NHS run. It's us together. You know, so many of you say, I'm fed up hearing, no, this is the council, or that's health, we can't deal with that, you've got to go to talk to someone else about that. We need to come together, so it's not one department or one organisation, it's multiple. We've got the fire brigade here still, and the police, they're a big part of it as well. It's not a set of projects, as I said, it's the very lifeblood and the foundation of how we're going to do things differently.
So we are here as a council, and our primary objective and what #2035 now compels us to do is to do everything as a council with the priority of improving outcomes for all of our communities. We've seen and we've heard about the great disparities that are present within our Westminster. It's our communities who are feeling and are living every day in Westminster. It's our communities that we are here to serve. So we have to work together with them. We have to learn from them about their priorities, their concerns, and then we have to make sure that what we are delivering is in line with those needs. We have to make sure whichever department we're in, from planning to finance, to communities to public health, from policy to children's services, we have to ensure that together we are working to improve outcomes for all of our communities. Community engagement is only as good as the actions that we take once we hear what we have asked. You know, together we can really work to support the improved outcomes of all of our communities. But it's going to take a different approach. It's going to take a different focus and a relentless focus on us reducing that life expectancy gap. All of you, come on board. It's #2035.